When we have a flood of patients, there will be many categories of these patients. So there will be people who are infected but well, then there will be people who are infected and need a little bit of help, and then there are people who are infected and need hospitalization because they're really unwell, and then there will be a small number who need intensive therapy units, ITU. We certainly do not have thousands upon thousands of isolation rooms. So under those circumstances, what we would do is cohort treat them, meaning you're all in the same pot and we're all going to keep you together. We do have a lot of what we call resourcefulness to create ITU beds out of nowhere. In other words, you bring in closed wards into action, we bring in spare capacity elsewhere to house these patients and cohort medically supervise and look after them. So we've got quite a lot of capacity to expand. That capacity isn't infinite, obviously.
Hospitals were recently advised that they needed to have somewhere to isolate people for testing purposes, and that is what those pods are for. They're not necessarily there to house people in them in the long term, but they are there to isolate people until test results are available and people could then be transferred to other locations. At this stage, they won't be taking measures to cancel operations or anything along those lines. That is something that would only happen if we got to a situation where we were needing to isolate large numbers of people. The NHS is more than able to cope with a small cluster outbreak, and they may have to draft staff in from other areas of the health service to support that work, but I think that they would be able to cope sufficiently.
The NHS is an emergency service. It's certainly easily able to cope with the small number of cases we've seen so far in the UK. What will happen is we will flex the NHS if we did get an epidemic based on the size of the peak that we both have and predict. We will model that out quite carefully and work out what needs to change to make it possible to have the service running to the best ability. We are clear that if there was a major epidemic, there would be substantial pressure on the service, and that's an obvious point to anybody who's thought about it. But it is actually something which we're already planning for. This is part of the mitigation strategy, so that if this happens, we're then in the best position to actually get the NHS working as effectively as possible.